thank you for that introduction. Caroline and the others from Ashoka have been very patient in hearing all my answers, because whatever question they ask, I always say, well, you put the patient in control of the medical records. How do you save money? How do you, in healthcare, how do you improve outcomes? How do you improve safety? Well, we always put the patient in control of the medical records. And it sounds geeky because I'm basically a geek. So I trained as a doctor and programmer. I went through medical school writing software. And I wrote 6 books about using IT in healthcare. And I want to tell you about the things I learned when I was in the USA, when I was writing one of those books. So that changed my mind about what was wrong in healthcare and how you can improve it. So 2006, I was speaking to a doctor called Dr. Jim Jergis. He was a physician in Vanderbilt Medical Center. And he says to me, a patient had come in with chest pain. So he thought it might be a tear in the largest artery, aortic dissection. So he sends him for a CT scan. And as you can expect, he's a busy doctor. He's got lots of reports to go through. So the radiology report comes back, and it says no evidence of aortic dissection. So he thinks the patient's fine, and he moves on. That month, though, he was experimenting by giving the patients access to the medical records. And so he gets an email from the patient saying, what's a thyroid? And he says, why are you asking about a thyroid? He says, well, the last line of the radiology report says there's shadowing on the thyroid. So what's a thyroid? And instantly, the doctor realizes what the radiologist was trying to warn him of, which is this patient probably has thyroid cancer, which is normally caught late. It doesn't have any symptoms. But fortunately, in this case, it came up on the CT scan as an incidental finding when he was checking for the dissection. He brings him in. Biopsy shows it really was cancer, but it was caught early, so patient's fine. Now, Dr. Jergis is not alone in making mistakes. He's a human being, therefore he makes mistakes. But he was unusual in how he responded. He basically said, from that point onwards, he begins asking all his patients to look at the medical record. He says, I can't know everything about you. You have to help. The family has to help. So if all of us are looking together, we can spot the mistakes together, and together we can solve each patient's problems. That's when I began thinking about the patient as an asset rather than liability. So one of the things that frustrates me in the public discourse about healthcare is that we almost seem resentful that people are living longer, that when they have an illness, they stay alive with it. And we talk about healthcare systems bankrupting the country and so on. But actually, if we started investing in the patients, allowing them to manage their health, we can celebrate the fact that we're living for longer, that we're surviving our illnesses, and allow people to take control of their health and take control of their lives. So I wrote the book in 2006, 2007. I got very excited, very proud of it, because with my genetic immune deficiency, I knew that millions of people could benefit if they deployed this kind of technology. And then I spent a year sulking because no one was doing it. And I began thinking, well, why are people stuck? Everybody can agree it's a good outcome. Why aren't people actually making this happen on the ground and at scale with that? So the first thing I realized was that many of them were beginning in the wrong country, the USA. So I left the USA and came back to the UK. So that was the right country to begin with, even though we built it from day one so it would work in the USA and the EU and any other country that accepted their privacy infrastructure. And it spent a year integrating into the National Health Service. And I began asking all my friends and medical contacts, who would find this useful? And eventually somebody pointed to me and said, Dr. Susan Hill from Great Ormond Street Hospital, who's been complaining for 5 years and asking for something like this. Go and talk to her. So I got a meeting, and she told me about 35 children that she had, who, for any of a number of reasons, couldn't eat food through their mouths. They had to have it through their heart. So it's a very complex care between the London hospital, the local hospital, the GP surgery, social workers, sometimes the teachers of the children, the private home healthcare company, and they had other patients from across Europe and the Middle East, so across state lines. So I said, very simple, you give your record to the patient, everybody else will do the same thing to the patient, and the parents will do exactly what you expect. They will give all of you access to the whole records, because they say, for God's sake, I'm waiting for all of you to talk to each other. So that's what happened. The first day, she sent out 5 letters to the patients in their record, and she calls me the next day saying, I got a phone call from mother saying there's an error in one of the letters. I've been a consultant 15 years. Never had anyone tell me there's something wrong with the letter. I know there's plenty wrong in the letters, but no one tells me. But because she got it in her records under her control, she could tell me. Then she says, what else can I send? And she starts giving more and more information to patients, so the patients began fixing the errors in the record for her. She also began to share data across hospitals. So what used to require printing of everything and sending it through the post, the families began connecting everyone to the record and saving money at scale. And so because of those things working, we're now at the stage where we're in 20 hospitals around the UK, and people are doing big projects. So we started from Torbay Hospital, which is about to do 90,000 patients. A county in the UK will do 1.6 million patients. And the US pharma company is beginning to integrate all their home devices. They can use this across the USA and the EU. And all this happens when patients are in control. Thank you very much.